Capener orthosis. Here we will demonstrate a dynamic extension orthosis known as the Capener orthosis. The goal of this orthosis is to increase the range of motion of the PIP joint by exerting a sustained light traction of the tight ligamentous structures. Use one strip of 6 cm wide Orficast, about 6 to 7 cm long, and another of 6 cm width, about 1.5 cm long. Prepare 2 finger coil springs. These springs have been calibrated and will allow a low load traction. Bend the small leg of the spring upward in order to make a small hook which will allow us to anchor the coil spring into the material. Cut away the excess length of the hook, preserving just a small hook. Take the longer strip of Orficast and fold it in half to create a piece of 6 cm by 3.5 cm. Cut a small hole in the middle of the piece. Slip the intended finger through the material. Mold the upper part to the dorsum of the first phalanx and twist the lateral edges of the material inward to avoid excess thickness of material between the fingers. Carefully mold the palmar piece under the metacarpal head while holding the finger in a 45 degrees flexion. Take the smaller part of the Orficast material, fold it in half as well, and mold this underneath the DIP joint. Let these 2 pieces harden. Remove the 2 pieces. Take the larger piece and trim the dorsal surface to fully expose the PIP joint so that the finger coil springs can be correctly positioned. Round the corners. Cut the palmar piece of the orthosis so that it does not interfere with the MCP flexion crease. Take the smaller piece and round all of the edges. Begin the assembly of the orthosis. Take one of the finger coil springs, heat a small piece of Orficast with the heat gun, and wrap this around the hook. Heat the base part of the orthosis. Attach the hook on the lateral side on the same level as the motion axis of the PIP joint. Make sure that the eye of the spring corresponds to the motion axis of the PIP joint. Repeat with the second spring. Attach this spring exactly opposite to the first. Put the orthosis on the finger. Measure the right length of the long leg of the finger coil spring. This should be the middle of the DIP joint. Bend the leg downwards to create a hook. Cut away the excess spring wire, leaving only the small hook. When cutting the spring wire, maintain a hold on the portion being cut away in order to avoid flying debris. Heat a small piece of Orficast with the heat gun and wrap this around both of the hooks. Heat both sides of the smaller part of the orthosis and secure the hooks to this portion. The force of the Capener orthosis is then determined using a dynamometer. Attach the dynamometer to the extremity of the orthosis and pull down. To determine the exact amount of force used, determine the difference between the initial posture of the patient's finger and the position with the orthosis in place. Avoid excessive force on the finger by ensuring that the difference between the 2 positions does not exceed 30 degrees.